everybody. Welcome to this week's episode of Tell Me More, Better Conversations in Healthcare. As you all know, my mission with this podcast is to improve communication between patients and their healthcare providers. It turns out over the last year that I've been doing this, that patients have pretty crummy conversations with their doctors. And my guest today is an expert in a couple of things, super interesting. One of them is the concept of picking the right doctor in the first place. So obviously, if you are having a conversation with the wrong person, it's doomed from the start. If you can connect with the right person as a healthcare provider, chances are you're going to have better conversations. So this is such a critical piece. I almost feel like we should start with that. So Ari Tulla, welcome to the show.
Hey, thank you so much. Really great to be here.
It's my pleasure to have you. So you do a lot of things. You are a serial entrepreneur. Would you call yourself that?
I try to build companies that help people live better lives. That's what I do, and I've been lucky enough to be, or maybe old enough to be able to be involved in multiple things over the last many years. Yeah, maybe that's appropriate. I don't know.
I love it. Very good. So I want to start by talking about your company, Better Doctor. So tell me about that. What was the concept behind that company? What was your mission?
Yeah, the catalyst. My background is in tech. I spent about a decade in the world of video games. And I was very lucky to be very early in the mobile gaming. Many of you probably have played a game on the phone. Those games did not exist, 20 years ago. And today, mobile gaming, of course, is the biggest single area of gaming, bigger than console games and others combined. 2 billion people play games. So I learned a lot about that world. But my story is like many other people who got to healthcare by not being a doctor or caregiver or a scientist. I was a technologist. And my personal story and experience led me to work in healthcare because I really deeply care about the fact that, it's the only place in the world where you can really save people's lives. And that is meaningful to me. And so my wife had a health issue year 2000, a while ago. She had a thyroid tumor that led into, it was taken away and parcel of the thyroid was removed, and it led into autoimmune diseases and hormonal imbalances. It led into a verdict that we can never have a family. And that's tough. You found the love of your life and you make a house together. And then suddenly you hear it, you can never have a family. Not the biggest deal, maybe you're 20, but over the years it started to bug us. And we really wanted to, have kids as well. So we spent almost 10 years in our life to try to find a solution. So we used Western and Eastern medicine. We lived in Europe. We lived in the US. It was really tough. I mean, we got help from people. We got a lot of advice, and many things didn't work. And in the end, we had somebody who helped us to think about, what about diet? What about nutrition? And she was going into a very early idea of a low inflammation diet, these sort of autoimmune diets that you now are prescribing to a lot of people. And it helped, and it lowered inflammation. The body was able to heal itself. We were able to get out of the medications, and then we got into, we were trying to have a family, and we had to go to IVF in the end, and then after about a 10-year journey, we lost our first son, totally unrelated to this problem earlier. And that was kind of like moment for our life. Like we spent so long on something, and then in the end it didn't work. And that was a moment when we decided to, we sold our stuff and we decided to focus on healthcare. And I moved from the video gaming world into starting a healthcare company. My wife became, in the end, a Konmari consultant, working in Marie Kondo, helping people to get rid of their stuff. She was in a corporate time. So that was a big moment that happened about 13 years ago for us. And I decided to spend my next 30 years on building healthcare companies. And the first problem that I felt very related was that, I don't blame anyone, but, we had some people who could have done things differently in the healthcare system. And that's partly why we lost our son. And it was a really tough thing as a parent, especially after that long haul that it took us to get there. Today we have my son is there. We have two healthy kids now,
Oh,
so it's all good. And
congratulations.
I'm more than happy to talk about this story, because so many people struggle with having a family. So many people are losing their children, even miscarriage or something else happens, and they don't talk about it. They keep it inside them. And these things are better to be shared, not to keep inside you, because they're going to eat you alive in the end.
Absolutely.
But for us, it was about how do we find the right doctor. I was at the time an executive in a gaming company, and we had access to every doctor in the US. And we moved to the country from Europe where you go to the doctor you are given. Suddenly, I have a book of million doctors to go for. Like, how do I know the right one? And that was such a big problem. And we were pretty smart, and we spent a lot of time thinking. We saw maybe 50 different doctors. And in the end, we found the right ones, but it felt like really overwhelming, because when you are sick, you are at your weakest. And at that moment, you can't make good decisions. It's hard to navigate. You need help. You need hand holding. And nobody was holding our hand. And we wanted to build a company that was helping people to find the doctor they love. Maybe the love is a big word there, but finding a doctor who can help you at the right time when you're at your weakest. And we built a website, we built a mobile app, and that was like 2011, I think. We were one of the first ones. And in the end, we had tens of millions of people using the platform. So it was really powerful that, something that you started from your own problem, your family problem, became a company that many people got a lot of value and help. And we were the first company who connected information like, consumer reviews. We can debate about that, whether that's right review doctors. There's a lot of opinions. I don't want to go there. We looked at the claims data as the first company ever to look at what doctors have done. For example, if you want to have a knee replacement, do you want to have the doctor in your vicinity who has done 1,000 of them, or the new doctor who has done 5 of them?
5, right.
That was information we were able to show to people first time ever. And many people, they really liked the fact that they were seeing more data behind the decision. But yeah, we learned a lot. I think I helped thousands of people myself who sent me an email, they called me, and they were asking for help. And of course, I had to help them, because that is the right thing to do.
Wow, amazing. So many things to unpack there. So first of all, so your company, Better Doctor, was basically a database of doctors' data based on claims, based on what they do, patient experience, which is where I think there's a very big place for reviews. I think the hard thing with reviews is, the validity of some of them, but I definitely think it's important to hear what other people think. So you built this database. So what did you do? Did you reach out to doctors and ask them to submit their information, or how did you collect data on doctors specifically?
Yeah, good question. And it was interesting because, I was a super user of the healthcare system, but I was a complete newbie.
Yeah.
I didn't really understand. And, I'm from Finland, Europe, and I came to the US, a few years earlier, and I saw a problem, but I didn't really know what made the problem happen. So what we did, we used information sources like, every doctor, you have an NPI number, for example.
Right.
So there's an NPI registry. There's a lot of different places that, doctors are listed. So we got all that data together. This was before AI, so it was like really like data manipulation, not that easy as today, but, we blended the data together into one place. And then we allowed doctors to go and claim their profile. Like if you want to add a photo or you want to add more, something is incorrect, you can do that. And we had, tens of thousands of doctors who came in and updated the data. We also did crawl all the photos from the, like rear books and stuff like that to make it. So we did a lot of work to collect data. I think we spent like 3 or 4 years on that work. We had a big team of people doing it every day. And then, of course, we wanted to make the data very valid, because we found out that people used our service, and we integrated online scheduling into EMR. So you can book directly. We're the first company to probably do that in the world. So you can book an appointment in the doctor's office. And we found out that sometimes, people booked for the wrong location, or people booked and there was no response. And we were surprised, like, what's going on? And maybe we were probably like maybe 2 or 3 years into the company. And we found out that many times the doctor address, the place of operation or seeing patients was wrong. And this data was coming from the government database. And we were like, well, how can it be? And we were maybe one of the first companies or people in the world to realize that the doctor information today, even if you go to your health insurance company for the billing system, that information is wrong. And that caused many thousands of people every year to go to the wrong place for care, because one doctor can be in this hospital on Monday and Tuesday, and then they have private practice on Wednesday and Thursday. You find the same doctor, you do the motions, and you go to see the doctor in the hospital, but that hospital setting is not covered by a health plan. And then you have this massive bill coming in that you didn't know. And how could you know? So something broke in the system. And we realized that, we have thousands of people going bankrupt because of these shadow pills or these pills that happen because of wrong data. And years after that, Medicare and Medicaid made a rule that data has to be cleaned up. So this is maybe, 6 years, 7 years ago. And that became the new business for the company. Yes, we were helping people to find doctors. It was really great mission, big impact for many people, millions of people. But we couldn't really make money on that. So the business for the company in the end became that we started to power companies like Humana, United Healthcare, Aetna with the better data. And that was mandated by government. So in the end, Better Doctor became a database, like you said. And then we sold the company to a much bigger company who is powering all the doctor networks in the country today. So next company was Quest Analytics that I was running. And that company builds doctor networks and makes sure that all the data is correct for billing purposes and also for the network requirements. Like you need to have a certain amount of doctors, a certain type in any given, for example, if for health plan. If you would have no, let's say, primary care doctors at all in a certain area, how could you have that health plan? You can't. So that became the real business in the end. And that got me much deeper into the weeds. And I spent a lot of time at the Capitol talking about access to care. We were helping to write laws in the end about telemedicine that could be done over the state borders. So I was really lucky to be part of that. And then nobody did anything for the papers and the laws. But then at COVID, those became because you had to do cross-border, and some of that language was written by me and my team. So it's just really cool when you get very deep into this healthcare.
That's amazing, because actually we are going through that thing right now. Like we did so much telemedicine over COVID, but the public health emergency declaration just expired, and so now we are back to being limited in our ability to do telemedicine visits across state borders. So that's fascinating that you were involved in that. So. But tell me, go back to your personal story. And I'm so sorry to hear about losing a child. I have 3 kids of my own, and that is the worst thing as a parent. I cannot even imagine. So tell me how, first of all, however much you're willing to share about that story, but then how that experience led you to say healthcare in the US needs help. Were you with the wrong doctors? You mentioned that maybe things could have gone differently for you and your family. Had you been with different doctors?
Yeah, I mean, there's a couple of things I maybe want to go in there. The first one was about the fact that, first of all, my wife had a condition that, was sorted out very successfully from the perspective of healthcare system. This happened in Finland, and, her thyroid tumor was taken away, and there was nothing beyond that. So really clean operation. Went perfectly in many ways. No impact on like the vocal cords. It's a big tumor, size of a fist in the neck. So that was like amazing. I mean, but then that was it. I mean, then there was like procedure is to then medicate you, and the side effect could be that you will never have a family. But that was it. There was nothing beyond that. Nobody called us back and said like, "Are you okay?" There was no like, maybe your mental health needs a check.
Right.
Yeah, but that was the kind of experience we had. That like the healthcare system did what it did, and the outcome was the good outcome. But the impact was a long-term impact that you're kind of getting in this challenge that we often have in medicine. That we do treat the very moment when you are sick. We take the sickness away, or we mitigate the sickness, but then you become chronically ill for 30, 40 years.
Yeah.
So the problem we have, and that wasn't okay for us. I mean, we really
Mhm.
like we wanted to have something more, and when we went into this and we talked to doctors, and people said that we don't know. It's not known, and then you realize that there are other people who are saying that yeah, I mean there are many things you can do, but it's not in
Mm.
the guidebook, it's not on the manual. And when you go off the manual, and we did that a lot in the US, so you have to go to do things that are risky. And of course, I mean, you mentioned the reviews, and I 100% agree with you. But also, I very much understand the doctor's perspective, where a bad review can destroy your reputation. And
That's
if
right.
somebody can do a review, few reviews that are not true, and then it have a huge impact on your whole business. So that is not fair, and I don't know what to do about that. But the same
Mm.
applies to the medical malpractice in the US, where you go off the script, you want to be brave. Dr.
Right.
House can't exist in the real world. I mean,
That's
it would
right.
be too risky. The hospital wouldn't have enough money to pay all the lawsuits. But the problem is that you can't go off the script, and if you do, you take a risk. And luckily, we had
Right.
some doctors who were willing to go off the script, and they even said that I don't know. I mean, I think this could work, but there's no science, and we were deploying testing like a keto diet a long time ago, for example, and that has an impact on lowering your inflammation overall. And those things are now working for a lot of conditions. So I think for us the problem was so that many doctors can't do the best work because of the limitation of the system,
Hmm.
being the manual that you have to follow, being the limited time they have with any given patient, or then having the risk of the malpractices, for example. And many doctors, I think, they could do a lot more if they would have the ability to be a bit more creative. And many people, I think today, and I'm been in this world, I talk about this publicly, so people come to me, but it seems like almost half the people have some issues that they don't know what to do about. They're lingering. There are these problems that they always take up, but they never get an answer.
Hmm.
And I mean, doctors also, I think, are very fallible. And I completely disagree with the perspective that we have today in the Western medicine, where we have a specialist on every piece of the body. And it's
Yeah.
a classic problem with the elephant, and you are blindfolded, and you touch the tail, and you touch the nose, and we have no idea what the thing is. But that's what we
Exactly.
do in medicine today. And
Exactly.
but at the same time, you are primary care doctor. You are the one who looks at the whole body, and you know better than anyone that that's almost impossible task because the human body is super complicated. I just spoke yesterday. There's a big AI event here in San Francisco this week, a TED conference about AI, first time ever. And yesterday we talked about we all were taking self-driving cars in the city here, and somebody told me that well, if we can do this, the car can drive us in the city with bikes and big like what are happening around you. And why can't we do healthcare? And
Yeah.
that the human body is still maybe like 1,000 times more complicated. It is a
Yeah.
very complex machine, and we are different based on the DNA, the epigenetics, all these things. So I think we need really to change the pattern and think more holistically. I think have better care teams that work together better. And also, I think we have to use AI. We have to deploy the AI to help the caregivers.
You are my hero in a lot of ways, I have to tell you now. So you mentioned the fragmented care, the elephant, the many moving parts. And yes, studies here have shown that patients that get excellent primary care, coordinated primary care, do better. Their healthcare outcomes are better. It's very simple, but there's only so many primary care doctors around, and our time is limited. Access to doctors is limited. So efficiency is key. And obviously there is a role for AI to, in my world, many of my colleagues are afraid that AI is going to swoop in and take over doctors' roles. That's never going to happen. But why can't we utilize AI to become more efficient and take better care of our patients? So there's obviously a role there for that. And in your experience, so did this happen with your wife? She had her surgery in Finland, and then did you come here and have some of the care here? Is that where the transition happened?
Yes, I think we got pregnant first time in the US, and we got really good care in many ways and solved the puzzle here. So that was really powerful. But then we had a related thing when we lost our son, and there was um, a thing that was kind of maybe possible to prevent, maybe not. Um, but that was then like a challenge that we had to kind of think about like what to do. Like, can we become pregnant again? And that was of course very very tough decision in a way. And my wife is the bravest person in the world to do that again.
Mm,
Because if it happens once, then you don't know if it happened again. So that was really tricky. And we did some medical procedures that had been done maybe like 200 times in the world before. So that
wow.
went to a very rare aspect of things that pretty progressive new medicine that we had to pay out of pocket a lot of money, and we had to find a person who does that. And luckily, I had a company that was able to kind of go through all the data, so I got to find who was the person who does this the most often. There was a code,
Right.
so we could find a code and find a person. And luckily, they happened to be like 100-mile radius from the Bay Area. But that was unique, and that was for me that most people would have never even heard about that option. We just had a broad array of people who helped us, and one of them had heard about it.
Wow.
That's why we have family. Otherwise, we could probably never had another run because it was too risky. But that's, I think, the challenge that we are getting really good at certain things. And I think the cancer treatments and all this stuff. I mean, we are really good. We can give most people many more years. And
Hmm.
sometimes we can take the whole thing away in a way that you have a scare, but you might never see it coming back. But at the same time, we are so bad at taking care of the people before they become sick. And that is really kind of the focus that I use my time today. We invest in companies who are trying to focus on the preventative care. My company, new company, is all about that. And it's just really, I think, tough because you ask like what was the dissonance in a way? What did the doctors don't know? I mean, doctors and any physician anywhere in the world, they don't have more than a one class max about nutrition and lifestyle. and
Right.
and nutritional lifestyle, I mean, are the reasons why we have half the people dying too young today, are the
Hmm.
reasons why we have lost 4.5 years of life expectancy since 2014. I love I've been talking about this for many years myself, and I look at the data every year. I love the fact that the Washington Post, they wrote this piece maybe a week ago,
Yep.
super cool piece, and now they are writing a new piece every week, and they're going to do this for the whole end of the year, I think. Really good summaries about these problems that most people don't believe. And it's very interesting when you see the data in a graph where we see we've been creeping up since, I don't know, 500 years ago. Life expectancy has been creeping up. No, first time it's dipping since the World War II and the Black Death in Europe.
Hmm.
Like, what's happening? And then the US drop is dramatically bigger than in any country in the world. There's a small dip in Europe and elsewhere, but it's like a year, and it's going up again. We are going down still today. And it's not just about COVID. It's really about the fact that we are getting sick as a nation. We are getting heavier. We are getting more chronically ill. And my worry today, when I look at the data and I look at these nuggets of the data, we have some groups of people like Native American men. They are now living 65, 67 years on average. That's the same number that you have in sub-Saharan Africa today.
Right.
It's unbelievable.
Terrible.
We're going down. By the way, we're going down from 100 years ago. Like, what
Right.
has happened? And it's not just about COVID. It's not just about the opioid epidemic, but it's really about this overall way we are living our life. We are too stressed. We are too addicted to social media, all these things. We don't move enough. I mean, we are also depressed. We don't have
Mm.
really. Many people don't feel that life is worth living. There's no future, and many people feel even that their kids won't have a better future. So those are things we really have to fix. And it's not a very societal problem, the whole thing. And that, of course, is coming 100 miles an hour against you, the doctors. Like, how can you take care of these people who are getting sicker every day and who have no hope, many of them?
So I'm glad you mentioned that, because I think you started out talking about data and science, and that's where we all live. We insist on show me the data before I recommend any sort of intervention, right? So a lot of what we do is based on true data that leads to pharmaceuticals, right? And you mentioned we don't get a lot of training in med school, at least we didn't when I went through med school almost 30 years ago, on things like the impact of nutrition, lifestyle, social support, all of that in your overall well-being. And now all of a sudden we're all shocked that life expectancy is going down, as all of these factors you mentioned have been around forever. We've just not been addressing them. So how do you give a typical patient some advice? How does a patient who's seeing a primary care doctor like me broach the subject of, I don't want to take atorvastatin for my high cholesterol. I don't want to be on a medicine for my high blood sugar. How does a patient have this conversation with a doctor who's traditionally been very closed off to the idea of any manipulation outside of pharmaceuticals?
If I'm talking to a patient like myself or my wife, only way really to stay healthy and have a long good life and a long health span is to take responsibility. It's up to us to take responsibility, pull from the bootstraps, and really, like, nobody will do it for us. It's our life, it's our health. The doctor is there to help you navigate, help you guide maybe, but you need to be the CEO. You need to be the quarterback of your life and your health. That's how it has to be. So it means that you need to think about this stuff. And I think I was a very lucky person in a way. And I built a very unique point of view because, we talked about mortality 23 years ago with my wife when she was in hospital. And how many people who are in 20s, nobody around them dies. And we go through a question and discussion, and that shaped who we became later. Because we've been thinking about this stuff and I've been, like, people call me a biohacker. I've been doing this for 17 years now, optimizing my life, testing all my biometric data. I've been sequenced many, many times. I've been scanned on every possible way you can think of. I'm a guinea pig for hundreds of companies. And it made me learn a lot about the human health. But in the end, it's up to me to make a decision, up to me to make a call, what I'm putting in my mouth today, up for me to decide, am I going to sit all day on this chair? I'm going to go walk to the forest nearby and go hug a couple of trees. It's up to me to go sleep at night at 11 or 10 or midnight. It's up to me to open the YouTube or open the TV at the too late hours. Those are my decisions. And those all compound into my holistic health. And the doctor or the caregiver or whoever I have, a coach, that person can help me. But I need to initiate the change. Behavior change. I'm building a behavior change company today. My company is trying to give people tools to become healthier. I can't help you if you have no will. I can't produce the will. It has to be in you. And that is the kind of the unfair position that doctors are in, because many people are coming there like, I need the solution. And they are not committed to follow through. So it's really up to us.
So as the patient, you have to advocate for yourself, but you also have to take ownership of your own behaviors, right? So a doctor can only advise you so much, and then you need to make those good decisions. And so I think we are getting better as doctors at recognizing some very key things like sleep, alcohol, smoking. Like, those are some very non-negotiable things in medicine. We understand that we have to coach our patients in those areas. But for other things that are on the fringes, are in terms of, maybe nutritional supplements, or maybe very specific things like the anti-inflammatory diet you mentioned. So if you're a doctor and you don't have data, you don't have significant data, how do you convince a doctor to buy into that? Show me your use case so that I can, because we have scientific brains. We need that to feel like the advice we're giving our patients is valid. So how do you convince doctors that there is something to be said for those approaches?
I think one key piece that we have been working hard at ELO my current company, is that we do blood biomarker testing at home. We collect the blood and send it to the lab and do pretty full panel that you would do today in a concierge clinic. And we spend a lot of time looking between the red and the green. What is the yellow area? Because the yellow area is the most important area. And I think if you look at the patient walking into practice, that person will have a problem maybe year 2, 3, 5 down the road. The question could be like, what could I do as a doctor today to initiate a change? And that question, like pointing to yellow, most of the doctors today, they live in a world of green, red, medication, chronically sick, done. I mean,
yes.
That's a fact, because I have been there. I'm at Kaiser Permanente today, and I love them. I think they're really great in Northern California. But I went to blood test there maybe 15, maybe 20th time in the last decade, and my A1C was 5.7. My A1C is 5.5, 5.4, and there was a little bit misreading, maybe 10%, 15%, and they now labeled me as a pre-diabetic. Wow. I have been wearing glucose monitor for the last 5 years every day, and I have my data. I can go to have terabytes of data about myself, and I'm 100% not diabetic. I can give you my insulin readings for the last 5 years. I mean, come on, I'm not diabetic.
Unbelievable.
I'm defaulting chronically ill in their books.
Right.
But that's the problem, that we have to be, and this was a mistake, but for most people as a doctor, people are going the wrong direction. And there's a company called Verda Health. I know the founder really well, and I'm lucky to be a small investor there. They're, in my opinion, the most impactful company today in healthcare in the world. So Verda Health is taking a diabetic patient, and they are reversing type 2 diabetes with diet. They have now done more than 10,000 people. It's covered now by every health plan, most of big employers, and they do it with the keto diet. They teach people to eat differently. And why it works is that there's often a doctor who will look the patient in the eye. These are patients who already are likely in insulin. They are maybe BMI over 30. They are telling the person that, hey, you're not going to see your daughter graduate. You're going to die. But I have a solution for you. And they'll look in the eye and this is the solution. And then people have the motivation because the person with the white coat told them that there's an option. And these people, they go full in. There are more than, I think, 10 people have tattooed the company's logo in their body.
Get out of here.
That's unbelievable.
Wow. That's crazy.
That to me is the moment when people actually are believing into something and something works. And I hope Verda will help. Their goal is to help millions of people. I hope they can do that in the next 5 years. But so you can take people out of medicine, you take them out of insulin, you get these people to become much better themselves. And they first time for 5 years they can tie their shoelaces, they can go for a walk, they can go for a run. These stories are unbelievable. And that is the power of a doctor in that instance, that they told them that there is a solution. But why it does have to be that late? Because these people all took them 30 years or 20 years to become a type 2 diabetic first place.
Right.
Why don't we tackle that 5 to 10 years earlier? Then we don't need to do dramatic changes. We can do minor adjustments, and the people will live 10 years longer default.
Oh my God, absolutely. So first of all, my life goal now is to have somebody tattoo my name on their arm. That's when you've made it as an excellent doctor. That's incredible. So to close with you, Ari, can you give me, I have a feeling I know what you're going to say, but can you give me what you think the most important yellow marker is that doctors today are ignoring that are going to impact our patients in 10 years from now? If you have to pick one yellow marker that we are missing the boat on, what would you say it is?
One is tough to pick.
Pick 5, whatever. You're most important.
Let's first one that we do great work already collecting is the weight. And BMI is not perfect, but that is a really, really good proxy. Then of course you have the the waist. What
waist
is the
circumference?
That's a really good metric that we're doing quite a bit now. And then I think after that, I'm not really a big believer into the lipid panel because we do that every time. And the lipid panel is more about the particle sizes and the details, what's inside.
Yes.
We often look at it totally wrong. Total cholesterol is super silly. My HDL is almost 80. So
Yeah. So
I'm
your
red on
total's
the
high.
yeah, like what's the point? And my particles are
You're
all big, so I'm healthy as anyone could be. And my
right.
numbers are quite high because I eat low carb diet. But then I think that it really goes to looking at like the insulin resistance, I think the metabolic health
Yes.
markers, and
Yes.
then I think ApoB, LPA. I mean, those are the ones that I think are the dramatically powerful markers that most people don't even know about or do.
Yeah.
But everybody should do those because they're going to give an indication of heart disease in a way that you can actually action upon early. And the insulin resistance, I think, is a really key piece. Before people get A1C up, we can already see in different markers that they are going there because 80% of people are today insulin resistant already, and they all will have type 2 diabetes in the next 30 years.
Wow. No, you're 100% right about that. So I have one last question for you. I just read Peter Attia's book, Outlived. Have you seen that?
A great book.
It's unbelievable. I'm now reading it for the second time, and many of the things that you mentioned, he talks about. So would you pick one book that you've read recently from a patient perspective and maybe another from a doctor's perspective that you think this book will change how you approach your own personal health care, and this book will change how you practice medicine? Can you think of two books like that?
Well, I think the Peter Attia's book, I think, is a really good, new, modern, fresh take about this topic. I think it's just a really good overall. And I think one book that is also really good because I really think that the metabolic syndrome is a key problem today.
Yeah.
There's a book called Metabolical. It's
Mm-hmm.
from Robert Lustig. He's the person who did the maybe 15, 20-year-old video on YouTube, I think lecture in Stanford, where he talked about the sugar. And
Oh,
that
yeah.
lecture has like, I don't know, 5 million views. It's pretty
Yeah.
unbelievable. And he is maybe the best expert in the world about what happens when we eat too many carbs, especially sugar. And
Yeah.
he is a fighter in this fight. Number one knight that there is today on this fight against sugar. And that is the fight I think that we must win. Otherwise, we're never going to be able to reverse this.
Oh my gosh. Love it. What a great conversation. All right. Thank you so much. So obviously, to recap, pick the right doctor, based on whatever data points you can collect, and take ownership of your own health. That's a hugely important message. And then for, doctors and patients, we need to rethink what our most important markers of health and longevity are. And maybe it is not the LDL as much as it is, your waist circumference, your BMI, how much you move or don't move, APO, what your particle size is. These are all things that we need to just become much more comfortable with. So I appreciate you so much, Ari. Thank you for your important work.
We need to accept the fact that, people have choices and people are lazy and people don't do any,
Right.
people don't want to do stuff that's difficult. People want to do the easy thing. That's why everybody will buy the GL1 medications to lose weight. People, and they work, they're magic, but that's not the only thing we should do. And I think a lot of doctors and everybody should think about this in a way that, I mean, take a look at, like, we can think about Elon Musk. We don't need to like him or love him or hate him, whatever. But he built companies that are pretty cool because Tesla is not just a better electric car; it is a better car.
Period. Yes.
Because it's a better car. Like, we need to make the world, the new world we want to take people to, we need to make it better. It's just not going to be like, better product, healthier pill. It has to be better. Like, we need to reinvent the world and make it more pleasant and fun and exciting and sexy. That's what we need to do a bit more in healthcare.
Ari, thank you so much. I can't wait to link your company info and your bio to our show notes. This is really very cool stuff. I know that you have opened my eyes to so many things. Thank you for your time. For everybody listening, my guest today, Ari Tulla, is like just a very cool guy to talk to. If you have had a difficult medical conversation or a very cool way to have a better medical conversation, please reach out to me, Christine at ChristineMeyerMD.com. Thank you for listening.